Hello and what's up, beautiful people? This is your tooth doctor, Maureen Mora here. Welcome back again to my YouTube channel. All we do is talk matters oral health, and it's simply because I believe everybody is entitled to good oral health status. And thank you so much for always staying tuned to this channel to get to learn anything in relations to your oral health. So guys, in today's video, I want to talk about this condition whereby there is a gum swelling or infection on one of your tooth, but then your tooth doesn't have a cavity. So you find that there is some sort of inflamed gum on your tooth, and the tooth is sound, or the tooth has not fully come into your mouth. This condition is known as pericoronitis. So basically, pericoronitis is that situation where we get the inflammation or infection of your gum, which is many a times associated with a tooth that is not fully, which has not fully erupted into the mouth. So if the tooth is kidogo uko ndani ya gums, the gum overlaps on it. And then now if you get a lot of bacteria, food debris getting into the gums, and it is difficult for them to be gotten rid of, they can cause some inflammation or even pain to your tooth. So pericoronitis on its own is that condition that is marked by the gum growing over a tooth, especially the wisdom teeth, otherwise known as the third molars. So pericoronitis can be classified into two. We have the chronic pericoronitis and we have the acute pericoronitis. In chronic pericoronitis, here we find that there is a mild persistent swelling on the affected area, whereas on the on acute pericoronitis, this is when symptoms intensify to fever, swelling, pain, and this can be an indication of a spreading infection inside the tooth. Having said that, guys, when it comes to the causes of pericoronitis, the primary cause here, we are looking at accumulation of food debris and bacteria. Remember, I said pericoronitis is where we have that gum growing on the tooth. So if there is a food packing inside or underneath that gum and bacteria as well, it becomes our biggest culprit here. However, there are some risk factors that can aggravate this condition known as pericoronitis, and that one include those aged between the age of 20 to 25, poor oral hygiene, excess gum tissue, teeth that haven't properly erupted into the mouth. We have fatigue, emotional stress, and even pregnancy as well. The signs and symptoms to watch out if you are having pericoronitis, and these ones, they normally vary depending on whether the condition is acute or chronic, as said earlier, and that is like pain, swelling of the gums, tenderness, redness of the gum tissue, bad breath, bad taste in the mouth, difficulty in opening your mouth, difficulty in swallowing, loss of appetite, and generally not feeling well. When it comes to the management approach of pericoronitis, again, this one also depends on the severities or the presentation of how you are feeling at that time. And here it entails one, management of pain, and resolving the swelling by use of pain relievers and some home remedies as well. We also have minor oral surgery, and here it entails the removal of the overlapping gum, especially if the patient wants to retain the tooth because of one reason or another. And we also have the removal of the tooth. And this one can only be done if it is a wisdom tooth, because if it is your normal tooth, or if it is your normal tooth that it's trying to grow, then it is easier to go for the surgical removal of the underlying gum. But if it is associated with your wisdom teeth, it is okay to consider having your wisdom tooth removed. Reason being, the flap, which is causing you to have this condition, it can be cut, but then after some time, if your tooth is not properly growing on the jaw, then the gum is likely to regrow again. So, earlier as mentioned about the home remedies, I want to give you a few tips on how you can manage pericoronitis from home. And that one includes gently brush your teeth, inclusive of the affected area, with a small head toothbrush, because this one can easily get to reach at it can get to easily reach that area which is affected. Remember, I've said it mostly affects your wisdom teeth, and the wisdom teeth ni zile meno ziko huko nyuma. So if you get to use a big head toothbrush, the probability of it not reaching or accessing those areas is difficult for it to offer the appropriate management that it is expected to offer. Also, rinse your mouth with warm salt water. This helps to soothe the area. If by any chance you are experiencing some pain and you can't access your dentist immediately, use over-the-counter pain relievers like paracetamol, and I always insist, try and stick within the prescribed range. That being said, the complications of pericoronitis in many circumstances are rare. The infection is likely to spread to, if it is your lower tooth that is having pericoronitis, or even your upper last tooth, it is likely to spread to your head, neck area. If it is on the lower side, the infection can travel or to the infection can gently spread to the neck, causing some serious conditions that we normally refer to as Ludwig-Sargena, and this is a life-threatening condition because it tends to block the airway. So we also have another concern: if the infection gets to spread to your bloodstream, then here again we are also looking at a very serious condition, and that is sepsis. That being the case, guys, pericoronitis is not something you want to ignore. Like, ni meno yangu inajaribu kumea, so once imemea fully, I'm going to avoid feeling like that. The only way for you to know whether it is high time for you to start being worried or not, it is best if you get to visit your dentist. They can help you know if you really have to worry, or not to just use the medication and relieve the pain as you wait for the tooth to either fully come out or even get rid of the tooth. So guys, I hope you've gotten to learn something. Once again, thank you so much for always staying to this channel, and let's get to meet in my next video. Adios.